When it comes to listeriosis, the most common would be the Listeria monocytogenes, and it is a gram-positive facultative intracellular bacillus. It's actually not a rod, but it's actually a bacillus. Again, this is not rod, but it's bacillus. It causes severe foodborne infection. The common diseases caused by Listeria in the population at risk are people who consume dairy products, chicken, and hot dogs. So, if a patient comes to your clinic and you gather the history, uh, you get to know that the patient consumed hot dogs, and then the presenting infection would be the foodborne infection. Think of listeriosis. For pregnant women, it can cause amnionitis, leading to abortion, stillbirth, or neonatal sepsis. For neonates, it can cause granulomatous infant septica and even meningitis and disseminated listeriosis in immunosuppressed or individuals. For the pathogenicity, it has leucine-rich proteins called internalins. This is very important, internalins, which bind to E adherents on the host epithelial cells and induce internalization of the bacterium. So, so since it binds, the bacteria escape from the membrane-bound phagolysosome by the action of the pore-forming protein, also known as listeriolysin O, and the two phospholipases. In the host cell cytoplasm, ACPA, or the bacterial surface, ACTA, on the bacterial surface, which is a bacterial surface protein, will bind to host cell cytoskeletal proteins and would induce active polymerization, thereby propelling the bacteria into the adjacent uninfected host cell. So they escape macrophage killing by propelling themselves into the adjacent uninfected host cell. So the protection against is mediated largely by interferon gamma produced by the NK cells and the T cells, as evidenced by macrophage. Morphology, they have exudative pattern, numerous neutrophils. And then infants born with this infection would have a papular red rash over the extremities, and listerial abscesses can be seen in the placenta. Buccal abscesses can have a grayish or yellow nodules and representing necrotic amorphous basophilic tissue debris. Pathologic finding, most common would be meningitis and with purulent exudate and with leptomeninges. CSF would be. In the CSF, there would be gram-positive intracellular bacilli that can be observed, and the neonates and immunosuppressed abscesses alternate with grayish or yellow nodules. So when you see grayish or yellow nodules in the abscesses, think of Listeria monocytogenes. Again, for infants born, there is red papular rash over the extremities and abscesses in the placenta.